Good evening and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I am Councilmember Priscilla Tyson, President Pro Tem and Chair of these committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation in the committees that I chair. This includes Health and Human Services, Finance, and the Workforce Development Committees. The goal of the hearings is to promote transparency and provide an opportunity for city residents to learn and to speak on legislation that impacts their lives. There will be on occasions on which a committee is not covered because legislation is not always scheduled for each committee. The intent of each hearing is to review legislation that will be on City Council's agenda for the following 2 weeks. Tonight, we will hear information on the legislation in the Health and Human Services and Finance Committees. We have 2 presenters, including Department of Finance and Management Director Joe Lombardi, and Columbus Public Health, the Medical Director and Assistant Health Commissioner, Dr. Mashika Williams-Roberts. I will begin with Legislation and Finance by asking Director Joe Lombardi to present. Director, the floor is yours.
Thank you, President Pro Tem Tyson. This evening, the Finance Department has 3 ordinances to be considered for the agenda on October 24th. The first ordinance is 2236-2016. This ordinance authorizes the Finance and Management Director to enter into one universal term contract for the option to purchase moist clay and glazes with Columbus Clay Company and to authorize $1 to establish that universal term contract. These items will be used primarily by the Columbus Recreation and Parks Department. These are for recreational activities and for recreational programs at our rec centers. The total estimated value of this contract on an annual basis is $25,000.
Thank you.
The second ordinance is Ordinance 2409-2016. This ordinance authorizes the Finance and Management Director to enter into a contract with Simplex Grinnell for the renovation of the fire alarm system located on the municipal campus in accordance with the sole source provisions of Columbus City Code and to authorize the expenditure of $45,000. Simplex Grinnell is the sole provider of the technology that we use here on the what I call the downtown campus for our fire alarms. And we have a speaker system within that system that needs to be connected. So we are going to connect all the buildings that are in the downtown campus so that when there is a hopefully not a fire alarm that goes off, our control center will be able to send out that announcement to all the buildings that are within the campus so that everybody can, all employees can hear it at the same time and be out of those buildings safely. So this will be an upgrade to that system to allow it to connect to all the buildings here in the downtown campus.
Thank you, Director. We're always focused on the safety of our employees as well as our city residents who could be in the building doing business here.
That's correct.
So certainly appreciate you giving me information on this legislation. I just have a couple other questions. Are there other security improvements that we expect on the downtown campus in the future?
Yes, so we also have a contract with KNS which actually handles all of our security cameras and the videos and the computers and the software that go with those cameras, and we'll be upgrading those as well to enhance the quality of those videos and enhance the programs. We will probably be bringing an ordinance later on this year yet to increase the dollar amount of that contract to allow for some more upgrades to those cameras and the software. And we're also looking at some of the improvements here at City Hall from a security standpoint to try to control the flow of traffic, so to speak, that come in and out of City Hall. So we are working to make this area more secure for not only us, but for our residents as well.
And I know that this legislation is for the downtown campus. And would you just share with me if you feel that our other facilities, which are outside the campus, are also in a ready state? Yes,
they are. We do have some obviously outlying areas where we do have security cameras and security measures, like at our fleet management. Even though we don't handle it, I know the Department of Public Utilities is doing a big upgrade on all their plants where they're adding not only security, they're actually adding backup power so that if power should be lost at those plants, that they would have another source of power so for security reasons and for the quality of our water. But I believe all of our areas around the city are secured, and security is always very important to me and very important to our facilities management division to ensure that those measures are taking place at those locations.
Thank you. I certainly know that there, in the past, we've also just upgraded from some of our recreation facilities as well as some of the police stations with additional lighting, and just because, again, that adds an extra security to our buildings.
Yes, that is correct.
Thank you. All right. Thank you.
And our final ordinance this evening is 2496, 2016, and this ordinance authorizes the Finance and Management Director to enter into a contract to purchase fleet spreader parts with Buckeye Truck Equipment and to authorize the expenditure. It should be Buckeye Truck Equipment and J.T. Dillard. In this contract will authorize the expenditure of $2 to set up those 2 contracts for these spreader parts. These are spreader parts for our salt spreaders that I know that are hopefully not used very often. And these are to ensure that we have parts for those spreaders. And the majority of the spreaders are used by our public service department, but we also have spreaders on trucks that are at Department of Public Utilities as well. So this will allow us to have parts for those pieces of equipment. Hopefully we won't need them very often in this winter.
Thank you. That will be great. And certainly it's such a beautiful day today that we have in the city of Columbus. We certainly don't want to think about the cold weather, but again, we know it's coming because it's Ohio, and we want to make sure that we are certainly prepared for not only our employees but also for the residents of the city. So thank you very much for your providing the information regarding the legislation.
Yep, thank you. And that's all we have this evening.
Thank you very much. And now transition to legislation, the Health and Human Services Committee, and ask Assistant Health Commissioner and Medical Director Dr. Mashika Williams-Roberts to share legislation from Columbus Public Health. Good evening.
Good evening, and thank you so much for having us here this evening. I have 2 items for consideration this evening, 2 ordinances. The first one is ordinance number 2545-2016. It's for the pharmaceutical invoices for our TB program. This ordinance authorizes the Director of Finance and Management to establish a purchase order with Capital Wholesale Drug Company in order to allow payment in the amount of $18,254.50 for prior acquisition of pharmaceuticals needed by Columbus Public Health TB program. Due to the issue with the city's transition to the Dynamics or ACTS financial system and delays with the vendor, the pharmaceuticals needed were not available for purchase through the city's catalog before September 2016 and were therefore purchased without a valid contract. There was an immediate need to purchase these pharmaceuticals in order to maintain patient care. I'm happy to answer any questions you might have.
Sorry, no, there are no questions, and we certainly want to make sure that we're getting the pharmaceuticals that we need. So thank you.
Thank you. The next ordinance is ordinance number 2552-2016. It's to modify a contract for process improvement project. The Board of Health entered into a contract with supplier Six Sigma LLC to undertake a process improvement project using the lean methodology to improve linkage to care for new consumers to medical case management services. As the HIV system of care was evolved and becomes more complex, the process of linking new consumers to medical case management has become significantly more complex, and a need existed to improve the process. Supplier Six Sigma LLC was contracted to manage, facilitate, and coordinate elements of our quality improvement project that seeks to increase case management standardization in the Central Ohio HIV Care Network using lean principles. This ordinance is needed to modify and increase the contract with Supplier Six Sigma LLC in the amount of $13,225.00 for a total contract of $45,225. Additional funding is needed because at the time of the contract, only a partial award of the Ryan White grant, which funds this contract was issued. Since that time, additional Ryan White funding has been issued, which allowed for funding to complete this contract. The modification amount was determined through negotiations with the vendor. These services were advertised through Vendor Services in November of 2015.
Thank you, Doctor. And can you just share a little bit about the lean methodology, please?
Sure. I can tell you a little bit about what the process is. The core idea here is really to maximize our customer value while minimizing waste. So the methodology relies on a collaborative team effort to improve performance by systematically removing inefficiencies. It uses consumer input and frontline staff guided process to increase the buy-in process and the success. And so we're doing this not only with our staff in the Ryan White program at Columbus Public Health, but we're also partnering with several other agencies in town, including Equitas Health, AIDS Healthcare Foundation, Nationwide Children's Hospital FACES program, as well as the Ohio Department of Health Ryan White Part B program. So all of staff from all of those programs are working with this lean project to help us all improve our process, increase more individuals from using our services, and making sure that we use the services and they use the services efficiently.
Thank you, Director, and certainly appreciate the work that I know Columbus Public Health and the other entities that you mentioned are doing to focus on HIV and AIDS in our community and making sure that individuals that have been diagnosed with the illness get the services that are required. So thank you for your work.
Thank you.
I hope this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health, as well as the finance-related legislation that is necessary to support our ongoing operations. As residents, these hearings are an opportunity for you to learn and to become engaged in issues that are presented. Before we conclude tonight's hearing, I want to thank from the Department of Finance and Management, Director Joe Lombardi. I want to thank Columbus Public Health, the Medical Director and Assistant Health Commissioner, Dr. Mashika Williams-Roberts, and also always want to thank my fellow council members and their staffs who serve our community with pride every day. I want to thank City Council's Legislative Research Office, especially Michael Kessler, who leads the Legislative Research Office, Andrew Dwyer, who staffs Health and Human Services and Workforce, and the development committees, Matt Erickson, who staffs the Finance Committee, and Aaron Beck from the Council's Legislative Affairs Office. And my staff, Nicole Harper and Carl Williams, the hardworking team of CTV who make these hearings possible, and finally the residents of the City of Columbus who make our city the best place in the country to live, to work, and to raise a family. And this hearing is adjourned. Good evening.